All right, let's chat exosomes in skincare. Could you explain what exosomes are and how they're redefining the skincare industry?
Yeah, in a simple word, exosomes are delivery messengers. So, an exosome is something that's an extracellular vesicle. It's something made by a cell. So, a cell has information it wants to communicate to other cells. So, it packages that information into a vesicle, sends it out of the cell, and then it goes along and gets delivered to where it wants. Once it delivers that message, it's gone. So, think of it as mailing a letter in an envelope. The exosome is the envelope. It's the content of the letter that makes that information powerful or potentially dangerous. So, an exosome in and of itself isn't good or bad. It's just a delivery mechanism. It's what the payload of that vesicle is. So, it could be cancer information, things that are harmful. And that's why the FDA has a lot of questions about exosomes and limits its use. So, a lot of work that's being done with exosomes has to be done super carefully, both in what they're actually calling exosomes and how they're using them. And the FDA definitely doesn't want us to do certain things with them.
I'm so glad you brought it up because that's your what's the worst part, right? Exosomes
Yeah,
can also contain, to your point, things we don't want, this,
absolutely.
such as the stem cell donor's DNA, and the lack of safety data and FDA approval are what make exosomes in serums and creams such a contentious trend. For example, a 2022 study published in the journal Stem Cells International suggested that exosomes taken from cancer cells can fuel tumor growth,
Absolutely.
which is why screening the health of donors is incredibly important. So thank you for bringing that up. Now let's move on to carbon dioxide therapy for vulva, vaginal rejuvenation.
Yeah.
You've spoken in the past regarding the importance of sexual wellness for women. How is CO2 lift playing a role in addressing these issues?
Yeah, I talk a lot. I give a lot of advice to my female patients. I think that women having regular orgasms is really important for our health and well-being, and it's so underrated. I have some women who are either widows or divorced or they're a little bit older. When I talk to them about vibrators, they all giggle, and then sometimes when they go and they actually listen, they come back and you can see they look more radiant. It's incredible. But the estrogen depletion that happens over time can cause dryness, change in that tissue that can lead to pain during sex, lack of desire for sex, thinning of that skin that can even cause some spotting. So, what I found with the carboxy vaginal treatments is that you do a series of these treatments, and what it's doing is it's affecting the circulation, the microcirculation of that area. It improves things like urinary incontinence, it improves stress incontinence in many patients. It helps with sexual pleasure, even enhancing the pleasure that women have and the desire for them to have sex because it's not painful anymore. So, all of those things go beyond that and they can affect relationships and just how comfortable you are in the world. I haven't seen anything that does no harm, that's non-invasive, that has this level of enhancement for such a sensitive area that so many women are taught to just forget about. And I sort of want to reawaken that because I think that it is part of life and it is part of longevity, and it's really important for women. There's no age at which having a sense of confidence about sex and pleasure should end. It should be at death's door, like when you're ready to just hang it up,
Thank
which
you for saying that. You just made a lot of women feel extremely comfortable for thinking the same thing because I'm right there behind you in that sentiment. Now, moving on to more proprietary uses of carboxy therapy. So, I understand that CO2 Lift is currently investigating the benefits of hair rejuvenation. What would your thoughts be on how this could help, considering it increases blood supply to the area applied?
all these treatments that we're doing for hair essentially just improve blood flow and oxygen supply to the hair follicles. So adding something like carboxy therapy makes perfect sense. Again, no downtime, not burning the skin, it's not painful, and it has a lasting benefit beyond just when it's on the scalp. So in my office, I do a lot of laser treatments. I use topical peptides that I've created that can help grow hair and stimulate the follicle. And I think in combination, it works well. But if you can now add this extra step that's cost effective, accessible, long lasting, and safe, it's a no-brainer for me.